na Dr. Zenator Rawlings mrashibedweni ema adehia ewo krote kole abatom peswa so de atodwa na wachem se ne Ghana mbebo ni bisa bisuba moni bia abo awure mu na nyasim kuma nduboni enom ka frafra saa no nom na tantan a eno nso nya de mfaso pa bia eno na ode atodwa achem se wenhwemu a se BBC adwumako ni ye no amana de so kopim otomale ni ntam a se de nyoma no ekokokoso no enya de esefata nti wasra se Ghana nyina yenkambo enye bibi ehona entimi emboa ne nsemo de todwa no ebi enie.
Mr. Speaker, Ghana is well known to be a hub and a transit point for illicit drugs. But this particular phenomenon that we're witnessing is quite shocking, actually. As a matter of fact, in my constituency, we have a cluster of schools, the Niamugi cluster of schools, where people who are addicted to drugs have actually invaded the premises, where they harass children, they harass the teachers, and recently, in the last 3 weeks, one of the security personnel in the school was attacked by a gang of drug addicts and is now in 37 military hospital in a coma. Mr. Speaker, the ramifications of this illicit drug inflow into Ghana goes beyond the large scale, but it's affecting people's lives. It's affecting the security in our schools. It's affecting the security of our ordinary citizens. And Mr. Speaker, the law enforcement agencies responsible for this need to be strengthened. We had, up until a few weeks ago, collaboration between the U.S. government with the government of Ghana, helping to combat some of this transnational crime and illicit drug use. Since the suspension of this, Mr. Speaker, I believe that may have contributed to what we are seeing. We need to re-engage some of these international agencies and strengthening our capacity to monitor what's going on in our borders and ensure that when we actually do track down these criminals, the prosecution of them and effective implementation of our regulations is actually done in order to be a disincentive for those who wish to use Ghana as a transit point. Our youth are really increasingly becoming a target of all of this. And Mr. Speaker, this is a national security issue because it affects our country in so many ways. It's affecting so many sectors, and it will probably require a whole, multidimensional approach in order to actually effectively deal with this issue.
Na we aye Dr. Zenator Rawlings in seminary to say Ghana baby a amanfo fa kra nuoma ba no e wose emie ni ewo na nuoma ekoye ede ema eye yen na yanto aso na yembote oni en sorry na yekopie mu ewo gomua oboase se langas fo bi akodi nsembone ewo Eric Don Alex Donko to aso ede amaye
Obuasi tension eda hoyi pa ane se nansi ya ne ntie se ahinsie bi ekoso ma namsoma kuruma no ekrahye ano na ndra kuruma no eye press conference na de tudwa se ensam na eba abonte no ne kura wo mi na se langas for samre na obi a osi no ho ade so no odo omkoy no omkokwa ataka ma te se enya asam ketewa me no kase bebre no eprepraye omo a langas for no de acid ene eye pepper spray edigo mo ani no omo ne edi nkomo na omo kamayo hosam ede kire eye TV XYZ no mosra aban se aban embremu sena be ya ne kure ne justice ebetum aba ewoye gomua oboase efise omope asomdwe
so ba na se boss some say yes no say wona was obetro here na se boss me dey miss na katro here I wanna slap how the way am so pow the way am pow e don with them ha slap with them ha no mo beat me o ko say o mo ha na o ba bo mi fi o de mi e say o ko sa
mama wan shoot o to tunam no ma rasi guy nto o tuna meko na na pa ko ka chese che guy no hard o nti yan fa sen ka se dan yan tu na musu be say me che guy no to tu nti bo no o kete edu no se me tu wa se so do se ne o nu wa se me misra be no fire straight bullet it's a problem bullet no say am na say ra show mu e twa pa no be wa pe wa say obi emia esuo ogu bi atwe elu arufu hono who said that nobody about this guy say maybe we away the same thing the problem when you come who say maybe we many work for crime who
na we ayamia adehia ewo gomua oboase ewo efutum party moje so mafemu ewo langas for ensem no sandra ewo eyampatem ho na je se moti winsemi
na yede nsam na se yese mabunu no enubone no mo no munyai wate na be se mo da ache yeda mase honorable Tamimu wo ko west krodue ni mana asemansi mu yetia na Dr. Mark Oliver Kevo minua mema otinkwa na chesese a wono na ye acting director general ewo nita eti nyankopon ka ho ate na yenimu say you make us proud na yede samnasi a yeda ya dubi anim piesi ase afi ofa bia eta ye chi akosua fari amanfo amapoma teteku kofia branch ekua krantema wo munyina boa na na adwo akwa achewa so na okumangrata ye chire na Elizabeth Tego any gift wo say wo mo esiese kofi the boy hwe cameraman ye ene team no MP mu no mo e kan raf munyina yeda mase mokote bekafo anumre eyeme be po so hema nana ya foriwa amanfo ko mai agudie papa bi ladies dembos enafi
akuya krantema
yada munyina se emammunity
Health Kwabena Minta Kando in a statement on the floor warned that the influx of unapproved drugs including tramadol brands and tapentadol classified as opioids has led to widespread abuse resulting in severe health complications and fatalities. Addressing Parliament, the Minister outlined government measures aimed at curbing this alarming trend.
In Ghana, Mr. Speaker, tramadol abuse has already caused significant social and health problems, particularly among young people. High doses of tramadol, often far exceeding what is legally allowed for medical use, have been found in circulation, leading to severe addiction, mental health issues, and even death. Following the revelations of the BBCI findings on Avenue Pharmaceuticals and Western International involvement in illegal opioid distribution, the Ministry of Health, in collaboration with the regulatory and security agencies, took immediate and decisive action. The FDA has directed Samos Pharma to immediately cease using these companies as exporters of registered products to Ghana.
These drugs, when consumed, work on the brain and bring what we call euphoria, which is what they will call in lay term the high. And therefore, they also exhibit something we call pharmacologic tolerance, which is that with subsequent consumption, you need to take higher doses to have the same effect. So the youth who engage in these drugs easily get addicted and have to take higher doses to get the same effect than before. And they are causing a lot of damage to our youth. The issue raised by the BBCI investigation, in my view, smacks of deliberate poisoning, because these drugs were not made for any medical purpose. And the combination is a terrible combination of a potent muscle relaxant and a very addictive opioid.
The Member of Parliament for Asitifi North, Ebenezer Kweku Ado, also made a statement on the floor calling for the Inspector General of Police, IGP, Dr. George Ekufu Dampare, to be summoned before Parliament.